Good morning, and thank you for joining us for this episode of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really excited today to bring on one of our longstanding partners over at Secure Aging. We have Miss Melissa Leedom. How are you this morning, Melissa?
Hi, I'm great, Amanda. Thank you for having me.
Thank you for making the time. I know how incredibly busy you are. You have such an important job. So let's just kick it off. Tell me a little bit about yourself, Secure Aging, and the planning processes.
You bet. Yeah, thank you. Yeah, so Secure Aging has been around since 2005. I purchased the company with some siblings of mine, and some of whom I work with in 2019. So we are co-owned by myself. I'm a CPA by trade. I say I'm a CPA by training and a care manager by heart. So we're co-owned by a CPA and a registered nurse. I have a sister who's an RM. And so it's a great combination to really help our families and our communities sort of navigate the changes, in the lives of a senior. And, we often say that we sort of serve as the coordinator of all things aging. And so
Yeah. You do a lot. You really do. And
we do.
when would you say the best time would be for somebody to reach out to you when they're looking to hire on services that Secure Aging provides?
Yeah, so we get that question a lot. And my answer to that is always as soon as someone is thinking about it. So oftentimes, there comes an urgency or sort of an anxiety around the question, am I prepared or are we prepared? And the last thing you want is for some sort of sudden occurrence to force you into that process of getting help or getting advocates. So, you could have something that would be sudden, like a severe fall or the death of a spouse, or let's say a diagnosis of cognitive impairment.
Sure.
And that kind of thrusts the family, thrust the senior into this, crazy outsourced life where you're just trying to understand what all these services are and who's doing what.
Yeah, I've always said when you operate in crisis mode, you make really bad decisions. And I bet that's when you get most of your calls is when it's crisis mode, unfortunately.
Yeah, we do. We do. Although, I'll tell you, we have seen recently, I think it's the result of the COVID pandemic, perhaps. But we have seen recently sort of this influx of clients who, believe it or not, now we call them clients in waiting, right? So we'll get a phone call, and oftentimes our clients have just done estate planning with their attorneys. And so we then get a phone call saying, I just need to make sure I have my, my bench, and I'd like to have you guys on my bench. And so we go through the process of setting up with them and just getting ready. And then we literally in our office have files that are client in waiting files.
Perfect.
And, once the client is ready to activate us, we get a phone call and, kind of the switch is on and we can step in and perform services at that time or any time, really.
And that's the best kind of client to have, because that way you have all the information ready. You can jump in and be that advocate, and you don't have to spend that pre time getting to know them. So a question for you. You offer nurse case management. I've also heard, especially with your CPA experience, financial care management. What exactly is a nurse care manager, and what is the difference between that and just a generic care manager that might be out there?
Sure. Yeah. So oftentimes we have our families who have loved ones that live out of state. So we've got a senior loved one who's living in state, and then we've got families out of state. And so, we'll often hear from our senior client, I really just want medical eyes, and my family would just like medical eyes in the home. And so that's really why the nurses come into play. So we've got a team of nurses. And as a nurse care manager, some of the main things that they do are accompany our clients to medical appointments. They coordinate with and among doctors and specialists and the families. There's a lot of sort of educating and explaining or helping the family to understand diagnosis. That often leads to, family meetings or family discussions. If there's a question of surgery or hospice or, surgery or no surgery, oftentimes a family is just looking for some medical guidance there, and who better to get that from than a nurse, right? Who has sort of, the clinical experience, but also really just enjoys nurturing and communicating and coordinating with families.
Yeah, I've often referred to your folks in your industry as like the medical or clinical daughter that you never had. It gives you an opportunity to translate that really difficult language that most of us normal people don't know. Even when I need a care manager when I go to my doctor's appointment. I don't know what they're saying half the time.
No, it's true. I like that label. We hear that a lot, and we often do become an extension of the family, and I always say, what better to have a bunch of licensed professionals who are an extension of your family team.
Exactly.
Right. It's a great place to be. And we enjoy helping families in that way.
Well, it also gives the daughter the opportunity to just be the daughter and not
Absolutely.
the caregiver, because it can be so incredibly stressful and it causes so much tension with families. So you guys, gals, everybody in your industry, you really are a lifesaver when it comes to keeping that family dynamic really smooth, translating the information in a way that they can understand. So I just think the world of what you guys do.
Yeah, no, thank you.
So now let's talk a little bit about, say that your partner is incapacitated, they've passed away. How do you step in and help with that? And what advice would you give to them?
Yeah, so let me just take this question as a chance to talk about the financial care management side. So, in addition to our team of nurses, we've got a team of geriatric care managers, that really focus on the financial side and just sort of general care management. And so we have a lot of situations where, the spouse or the partner has passed away, and that was the person who was doing the finances. And so now there's this sort of sort of moment, right? Like, my gosh, what am I going to do? And so, there's a statistic that 3 out of 4 seniors have anxiety about bill paying in general, right? I mean, I think 3 out of 4 people have anxiety about bill paying. So what we do is we actually come in and just alleviate that. Having to focus on the health is enough for anxiety. And so we just kind of come in and we start really simple in the home, with the senior, with the loved one. And it's really, usually the mail is overwhelming. That's one of the first things, right? There's piles of mail, or there's just, I don't know what to do with this mail, Melissa. Oftentimes a cell phone has been shut off. There are missed payments on credit cards or overpayments. And so we'll come in, we'll sort the mail together with our client, depending on the level of cognitivity and the level of service needed. So we would go through the mail, we would help with bill paying, meaning, so we're not going to sign the checks. We're not their power of attorney, but what we're there to help them kind of have ease of mind. So we'll help prepare the checks. We'll write out the checks, and then we'll sit there. And if they're cognitive and they've got capacity, then they're signing them. If not, then we're coordinating with their power of attorney, whether that's a family member or a lawyer. I've got a lot of clients who don't have anyone. So sometimes it's, well, Melissa, what do you do when you have no one to do these things? And in that case, I will step in as a CPA. I am able and very willing to become a power of attorney at that time. And I often like coordinating, with an estate attorney or, an elder law attorney.
Mm-hmm.
Our nurses will step in and become the health surrogate for our clients who have no one, or even for a family member who doesn't feel comfortable taking on the medical piece.
Yeah. And you hit the nail on the head. I mean, here we are again, talking about family dynamics and why a company like yours can really be beneficial, not just on the nurse side, but on the financial aspect of things too, especially for siblings that might not really, trust each other. So tell me a little bit about how family dynamics can help, or it can play into the aging process, and how secure aging can really help keep things at bay.
Yeah. And, I think, so I'm one of 8 kids, right? So all adult children at this point, we're all in our 40s or older. And, you know, it is a crazy time when something, you know, when there's a crisis or when there's something that, you know, multiple parties seemingly have to agree on, but, you know, not necessarily legally. And so, you know, I think that we have the ability, to your point, you know, to enable, there are so many things that are being coordinated by families at this time. You know, we're often helping to coordinate family meetings, family councils, family mediation. So, you know, just last week we had an experience where there were an adult son and an adult daughter are co-trustees of a trust that they're administering for their mother. So, you know, they're basically, you know, when you administer a trust, you're essentially paying the bills, right? You're the one signing the check for the loved one, and they're at odds with each other, the adult son and daughter. And so we got a phone call to come in and become, you know, essentially administer the trust or do the bill paying for their mother. And they're not even talking to each other at this point. And so then you lead to discussions around, you know, there's a severe fall. And so should we have hip surgery or should we not have hip surgery? So then, you know, as a financial care manager, I would then pull in a nurse care manager. You know, down the road, that could lead to a decision of Medicaid planning. Then I would pull in one of my geriatric care managers or my, you know, aging life care specialist who specializes in community resources and can do the connection there. And so, you know, it's a moment where you're often in a hospital room with two adult children who haven't talked. You know, we had this situation, they hadn't talked in 15 years. They were so at odds. And so now there's a coming together about a decision. So, you know, it's tricky. This is why we call it navigating the gray, because it's very rarely black and white. But I think if we keep in mind that the heart of what we're doing is helping that loved one and helping the family, you know, to find some peace of mind about what the situation is or what they're going through, you know, to the extent that we remain calm, it helps everybody around us remain calm.
No, I absolutely couldn't agree more. And as I said, I'll say it again. I find so much value in what you do, and it's such an incredibly rewarding experience working with you and your industry. And I know that the more we talk about it, the more people will realize that the service is available. It's out there. So for more information on getting in touch with Melissa, click the chat above. And Melissa, I just want to thank you so much for your time today. It's so valuable, and we'll have you on the show again soon.
Sounds great. Thank you, Amanda. It's been great talking with you.